Hi, I am Dr. Paola Suglio here at Palm and Pearl Dental. Today, I will be answering the most common questions we get asked by patients about dental implants. Dental implants is a permanent solution for missing teeth. Dental implants are metal posts or titanium posts that get placed in your jawbone and it flew away. That are placed in your jawbone to replace a missing root that is going to have a custom made crown on top in order to give you back the chewing capacity and the smile that you need. What conditions do we as dentists recommend for a dental implant? The main reason is missing teeth. When patients are missing teeth, of course, the best way to replace that tooth is with a dental implant. The advantages of dental implants are that they are going to replace or give you back the root that you lost, are going to keep stimulating your bone with the chewing after the implant is functional, is going to restore your functionality and of course your smile. If you as a patient need and decide to go through the process for a dental implant, the way that we do it here on Palm and Pearl Dental is the best way to go, because we're going to put together first a treatment plan that is custom made for you, and then we're going to collect a lot of data that is going to allow us to put the best treatment plan for you. And it's going to consist, we're going to do a 3D image, which is a CBCT, in order to determine where are your anatomical structures, how tall and wide is your bone, so we can definitely put an implant in the predictable space. Besides that, we're going to do an intraoral scan that is going to register your mouth as it is, and we are going to design a custom-made surgical guide that is going to walk us through and allow us to place the implant the most predictable way with no second guessing. The steps of placing a dental implant starts when you come in for the first visit, where we do all the diagnostic tools, and then we plan together with the lab and your surgical guide. We have the implants that you need, and the day of the procedure, you're going to come into the office. We're going to get you nice and comfortable, and then we are going to go through the process to prepare the site where your bone is going to receive the implant. Now, if you do need an extraction, it can vary. We can place the implant in the same appointment of the extraction, or if there's an infection, you might need some time for healing, and then we're going to place the implant. The process can typically take between 4 until 10 months, depending on the case. When bone graft is required, I get that question asked a lot of time. It's very common. After we remove a tooth, the tooth is pulled and the socket is empty. In order to preserve the walls of your bone, we graft the area to prepare the site to receive the implant. When you're choosing what kind of teeth you need or you want, it all depends on how many teeth you're missing or what's the general overall condition of your existing dentition. If you're just missing one tooth, like in this case, we will put the implant here and you will have your natural teeth next to it. If you are missing all your teeth when you don't have any teeth, you might need in between 4 or 6 implants. And for that one, we might do either a removable or a denture, or we will provide you with the best option, which is a fixed denture over the implants, which is going to basically give you the same feeling of your natural teeth. Now, if you do have gum disease where your teeth are fall really sick, and then you might need all the extractions, we can also do the procedure with all the extractions and the placement of the implants and the placement of immediate teeth in the same appointment. The recovery time for dental implants, it also vary on what kind of surgery you are going to be facing. So if it's just one tooth and one implant, the recovery is extremely easy. The patient typically doesn't need any pain medications. It's very straightforward. It's very predictable. It's a short appointment, and afterwards, of course, you can expect some kind of soreness, but no pain. It's easier than the extraction, actually. Now, if you're having a full mouth extractions with 4 or 6 implants, of course, the recovery is going to take a little bit longer. Dental implants have a success rate above 95%. So dental implants can last your life if you take proper care of it. But that's a big statement. So it also going to depend with your oral health, with your medical conditions, with what if you go through a specific illness, if a patient has a cancer and goes through chemotherapy and radiation, that can affect the integration of the implants in your bone, and then implants can fail. And also, if you don't take care of your oral hygiene and you're not compliant with your dental checkups, that also can jeopardize the integrity of the implants. Also, if you're a smoker, that is something that is a red flag for integrity and for longevity of implants. Dental implants don't get cavities. They don't. You're never going to have a cavity around an implant, but you can get periodontal issues or around the implant, or gum disease around the implants, because the implant, it's in the bone, and if the integration of that implant with your bone is lost, and then your gums are going to get affected, and then of course bacteria is going to deteriorate the integration, and you might lose the implant. Dental implant by itself, it's around $1,900, but you also have to consider all the diagnostics that you need to do before that, which are CBCT, intraoral scan, 3D images. We also need the surgical guide. Now, if you have an extraction done, you also need to consider the cost for the extraction and the bone graft. And at the end, of course, the placement of the crown, or if you need an overdenture or full fixed denture over implants, the cost is going to vary. Regarding financing options, we do have financing options for you. So we have external or third-party finances like Sherry and Care Credit, and also we have some other incentives for our patients. Insurance typically doesn't cover for dental implants. They just don't pay for dental implants. They don't pay for bone graft. That's why we give you the financing options here in the office. The best way to schedule an appointment with us is giving us a call at our number provided here in our website, going to our website, or just pick up the phone and dial 239-435-0200. We're more than happy to get you scheduled, and we're more than happy to give you complimentary consults and second opinions. We are here to help you out.